Welcome to Power Lunch Live. I'm Rhett Power, your host. It's a beautiful Tuesday afternoon where I am, and I hope it's a nice day where you are as well, particularly if you're still sequestered away, working from home. The point of the show is to have today's thought leaders, best-selling authors, CEOs, people who are doing amazing work in the world, who we can learn from, who have some amazing insights that will help us do better at what we do. And today is no exception. We've got a great guest today, and we're going to introduce him here in just a second. I can't speak today for some reason. English is a tough language sometimes. Anyway, so we broadcast on Twitter, YouTube, Facebook, and of course LinkedIn. The fun part about all of that is that you can ask your questions of our guests. So get on your computer, type your questions that are burning in your head, and so that we can get to those answers. We'll monitor those feeds throughout the program for questions. Now, today is going to be a lot of fun. We're going to talk about healthcare and healthcare tech and some of the changes that we're going to see here that we're seeing already with telemedicine and health tech and all that. We're seeing lots of changes already. So we're going to talk about that today. We've got Blake Marggraff. Blake is the CEO of Epharmix. Did I say that right?
Epharmix and now CareSignal.
Epharmix.
Yeah.
Epharmix.
CareSignal is definitely the new brand.
Yeah, CareSignal, this company is at the intersection of medicine and consumer technology, offering interventions that use automated phone calls or text messages that help medical personnel manage patients and conditions while collecting desired specific disease-specific data. I'm sure that's actually even evolved during this crisis, so we're going to get into that. Blake, welcome to the show.
Thanks, Rhett. Great to join you. Thanks for taking time.
So you started a company while you were in college called Varsity. You won an Arch grant for that. Talk about that experience and how that prepared you for what you're doing now with your new company, or it's not really new anymore, but talk about that. Talk about how that early experience helped you.
Absolutely. So, I think the best founders and entrepreneurs are solving a problem that they have. And as I was a student, I got to know some other students at universities across the country that all experienced the same challenge, which was when you're in a STEM field, especially on the engineering side, there's actually about a 50% chance that you won't finish your degree,
Really?
which is kind of striking. Yeah, about half of engineers don't finish their degrees. Now, that's not to say they all drop out, but a lot of them switch to other tracks, right? And both of us I'm sure we can think of a couple friends during college who kind of changed. That boils down for the most part to those individuals not feeling like they can get hands-on with what they're learning in the classroom, right? You hear about something super cool. What do you do with it? So Varsity and Varsity Labs, the whole goal was to bring that maker mindset into reality. And from the founding story perspective, it was just beyond a privilege to start that business with the founding team. We grew from nothing to cash flow positive in the course of about a year, and then received in St. Louis what is kind of the really the top startup honor, which is an Arch grant, a non-dilutive $50,000 grant, which let us make the capital investments necessary to scale that company nationally. Supporting universities from UNC to Duke to MIT. And this was during mostly my sophomore and junior year of college, so a pretty steep learning curve.
Absolutely. And what actually happened to the company? How is it still around?
It's still going. Oh my gosh, yeah, it's impacting tens of thousands of students, and they've expanded now Varsity Labs to cover not just universities but also primary, secondary education.
Okay. And the results are people. Did you think you accomplished what you wanted to accomplish with it?
I think so. I think it's always hard to judge, and I think that Varsity Labs as a business was was never supposed to be the ridiculous high growth technology company. I mean, at the end of the day, it was a physical product that came first and comes first. At the same time, Popular Mechanics named St. Louis the #1 startup in the city, startup city in the country, and had a giant centerfold spread of BetaBox, which was the main product. So, humbling, just again and again. It was a great experience.
Do you think that helps you? I work with a lot of startup entrepreneurs, and you think a success like that, it's got to help you in raising money. It's got to help you in giving investors, because you've been through your own round for your company now. Did that come into play at all, you think?
Yes, sir. Absolutely. One conversation with a pivotal investor. I remember exactly where we were sitting in the exact coffee shop as I was starting CareSignal, Epharmix CareSignal, and the investor said, "Okay, we've made it this far. I'm definitely interested. You have to answer one question." And I thought it was going to be a joke. I thought it was going to be one of those, right, "Well, you take my money." And he said, "What's one thing that every company needs?" And it became clear to me at that moment. Question. Yeah, and it became clear to me that he had the right answer, and that if I didn't give the right answer, that was it. And I thought about it for what felt like approximately 10 million years, and then said, customers. And I'll be damned if this investor didn't stand up and slap me on the back and then point to me in front of his associate and say, "He gets it." He roared, "He gets it. He gets it." And I was like, turned the key out of that missile, silo. Yeah, and a lot of that came from, I as a biology major was in charge of sales for BetaBox Labs. I'd hop out of a class and find some corner of the hall with Wi-Fi and without too much echo, and then hop on a sales call with the dean of engineering at a university across the country. So I had deep empathy for the importance of really just the kind of the nuts and bolts side, the get your hands dirty side that a lot of folks don't think about.
Mm-hmm. That's a fantastic question. I wonder how many people he'd asked that before who got that question wrong in his mind.
Yeah.
That's fantastic. What are you hearing? You raised $7 million in your round. How is COVID, you think, hurting or changing the sort of the investment landscape?
I think COVID is is leading a lot of investors to call out emperors without clothes. There's been a trend toward borrowing from the future, and my entire team knows that we as a company, as a rule, we do not borrow from the future. Whether it's making promises on product features, whether it's planning hires before we have the capital or cash flow, I think all of that falls in the bucket of betting on counting your chickens. Short version is this: no longer are we seeing double-digit multiples on annual recurring revenue.
Right.
We're definitely not seeing those multiples on pipeline and speculative revenue.
Right.
And there's more of a focus on value instead of shiny good ideas without direct financial value.
Yeah, I think that's probably accurate. No more 10x, right? No more 10 times. I think it's people are going to, as you said, look for more conservative valuations. Yep. So talk about digital health, because I think we're on this cusp of some real innovation and some real change. When you started your company, what was the vision? Why health? Why health?
Sure. Oh, wow. So I think that's almost a philosophical question. I think that founders of startups have naturally high locuses of internal control. You believe you can bend the universe a little bit at least, and that is fundamentally irrational. But damn it, we believe it anyway. Also, extremely high need for achievement. And I think that the third ingredient is you see people that either want to just straight up make money or people that maybe want to do something a little bit more than that, that derive some meaning from more than just the capital, especially, frankly, in the millennial generation, right? Pros and cons, but we want to have a positive impact on the world. If you're going to do that, help people live better lives, help people live longer lives, I think education and healthcare are the two best ways to do it. So that's the very altruistic view. The slightly more pragmatic answer is, when my chief medical officer and I were first chatting about what would become CareSignal, we realized that the problem in healthcare was not a lack of technology, not in the slightest. You can throw a stone and hit 10 healthcare technology companies. The problem was really in aligning with the incentive structure, with the operational needs, and then creating an adoption model that would pull instead of push adoption in the industry. And in healthcare, what I think that boils down to is one thing, truly just one thing, which is evidence. You need to prove that you can engage the user type, could be patient, could be provider, could be payer, that you can drive clinical outcomes if that's your focus, and that you can then tie those to financial returns. And if you can't prove those things, you might have great technology, but it's worth next to nothing.
Right. No, that's true. What, so with CareSignal,
yep.
How are you evolving? I mean, is COVID changed your game plan at all?
I wish I had the sports metaphor to answer to answer this perfectly, but I don't. Look,
give us the long answer. That's fine. That's all good.
That's all. I've never been more confident in the fundamental value proposition of CareSignal, which is by impacting clinical outcomes for patients with chronic conditions to affect at least a 5x return on investment multiple for our direct customers, and crucially a 10x return on investment multiple for the industry, right? And I think that's different from a lot of we can get into it, but fee for service versus value-based healthcare, there's a lot of opportunity for arbitrage where, you take $1, you give $1 back, right? And I think valuations now are reflecting that. That's not our game. COVID has forced most of the target market of health tech, payers, providers, to reassess and reevaluate priorities, both short-term and long-term. Short-term, if you're selling some fantastic but COVID irrelevant medical device, you're out of luck, right? It's not your fault, but the world shouldn't focus on what you're offering, right? For CareSignal, we're darn close. Chronic conditions, obviously, you need to support those regardless, but I totally understand when our sales pipeline says, hey, we got to push this back, 2, 4, 6 weeks, maybe even longer. Long-term, never been more confident. There's even more need to support patients now that pretty much every patient, even ones 10 feet from their doctor, are having to pretend to be rural patients. Boom, that's in our sweet spot. But that means that there's also a battle to remain relevant and to build relationships and to generate leads and sales opportunities when conferences, which accounted for most startups, 50, 60% of pipeline, aren't going to happen for the foreseeable future. And in my mind, that means looking at your core competencies, determining if you can introduce a product or a product suite that leverages those without becoming a distraction or a burden on the company. And if so, then executing extremely quickly on that.
Well, how have you made that sort of shift? What's your thinking, and how are you going to handle the change in the opportunity? I mean, no conferences, no. How do you make that transition?
Yeah, that's
another way.
I'll tell you how we're doing it. Only time will tell if we did it correctly. But within about a week of really the country locking down, so we're talking early March, we had a full suite of COVID solutions, COVID Companion, and we even bought the domain covidcompanion.com to make it really easy to communicate what we were doing. We're not trying to shoehorn this into some CareSignal, It's a no-cost, zero implementation program that helps healthcare providers do what they need to do, which is educate and engage their communities, their staff, and as necessary, patients who are under home quarantine because of potential exposure or symptoms. That's it. Those were the 3 pain points that we zoomed in on quickly. And I think that the key to our approach there was the zero implementation element. Usually healthcare wants to get everything right, cross every T. But everybody was moving so fast that if one thing would kill a potential innovation, it would be the need to thoughtfully piecemeal everything together.
Right. Explain Care Signal. Just let's get to the basics of what you do, because I think we kind of maybe skipped over that, and I should have covered that earlier. But so explain how the system works and what the technology is.
And honestly, you summarized the theory perfectly at the top, but let's just give an example, right? There are tens of millions of individuals across the country with chronic conditions. And I would go so far as to call those ambulatory sensitive conditions, right? So these are COPD, heart failure, depression, poorly controlled diabetes, and then another 24 or so conditions that represent the majority of cost as well as burden.
Okay.
The problem here is, for the very top, most expensive, frankly, sickest of those individuals, they're getting decent healthcare, or at least many of them are, right? That's the get them a phone call every single day kind of. But the folks below that, think of the folks below the very tip top of that pyramid, they're generally not getting what they need, frankly, what they deserve in terms of support. And that's where Care Signal comes in. We use kind of the common denominator of technology. So we'll use texts and phone calls to ping those individuals with simple questions, checking in on what really matters most for their conditions. And the magic part is, for the 1.5% or so of that group that needs a touch on a given day, Care Signal then closes that continuum to make sure that the healthcare provider or the person responsible for that patient's outcomes can reach out, have a productive conversation. If I have heart failure, I'm a 72-year-old with heart failure with an income of $12,000 a year, and 3 weeks from now my legs start to feel puffier, suggesting that I'm retaining water, really bad sign, then my healthcare provider would get an alert saying, hey, Blake reported pedal edema, might warrant a 2-minute phone call, titrate Lasix, increase my antidiuretic or my simple Lasix regimen. That's it. And that could very well be a $12,000 phone call. Wow.
Okay. And so you really sort of help bridge the gap and help sort of automate that process for healthcare, right? And then it flags things that are really important and need attention.
Yep.
But in other words, it sort of you help them monitor people's health, in other words, and get that critical communication going back and forth every day. That's amazing. What is, and if you had a crystal ball, what other kind of tech and what do you think is going to emerge from COVID? Because we hear a lot about telemedicine, and we hear people talking about that, but what else do you think is really going to emerge from this crisis? And is there something new that you think is going to sort of emerge from where we are now?
Yeah, I think a lot of what would have happened naturally will be and is being accelerated. Telehealth, literally just talking with a healthcare practitioner, NP or physician over video is a great example. I think the thing that I'm most excited about, and that frankly I would pay the most for an actual crystal ball for, is the incentive change. Healthcare has always been bending away from paying for a procedure. You get your throat swab, pay $5. Get your ear looked at, right? Moving away from that to a value-based model where the goal is simply keep the patient healthy, and thereby keep that patient cheap in the eyes of the insurance, right? Honestly, no complaints there, right? That's great for the taxpayer, everybody. And COVID's accelerating that. I think in order to maintain control and drive down risk for the most vulnerable populations, folks that are over 60, 65, folks with chronic conditions, the incentive will need to be to support the health of those folks in the first place. And that's where, not to get too wonky here, but Centers for Medicare and Medicaid Services, right, which controls a not measly $1 trillion of our spend as a nation every single year. And by the way, also sets direction for the commercial insurance and the self-insured employers. So they're pretty much spearheading all of this. I think as they start stepping up even more initiatives to incentivize care for that population, everybody wins. Everybody wins. And nobody more so than the patient, who is now at lower risk for potential future COVID-19 infection.
Yeah. And I mean, it seems to me that, the way that we've gotten rid of, or they've just gone away because of the system, excuse me, all of our, if you live in a rural part of our country,
yep,
you're going to struggle with getting really good healthcare. And I think that is certainly telemedicine is certainly one of the answers to that. I mean, it just makes so much sense. And I know that there are health or security concerns or privacy concerns, but it seems like we should be able to figure that out.
Yeah.
I mean, it doesn't. How has the pandemic, do you think, changed your company, and has it changed you at all as a leader?
I mean, I'm fortunate to have just a phenomenal team. Just a phenomenal team within my work each day. Flexible, driven, focused on the outcome, and not the process first. The most obvious answer is we've gone remote, and we've been remote, and we probably will be for quite a while, at least in many ways. That's forced us to rethink how we communicate day to day. Even beyond, Slack and Zoom and Tandem and all of these other,
Right.
But we have one of our cultural pillars as a company is learning, right? How do we all keep learning and growing? And some of that happens pretty organically when you're all in the same physical place. So recapturing that has been a big focus. We did a company-wide survey to figure out, how this had changed, how each teammate perceived how rewarding his or her role was, stress, ability to communicate, in department, in company, with outside world. And the overall consensus really is we're fine being remote, completely fine.
Really?
Yep. I added one question, which was pretty much, are you comfortable day to day? And one of the answers was, my butt falls asleep in about 10 seconds. And I think that might quite literally be the biggest barrier to sustaining remote long term, and can be solved with a new seat cushion.
Or standing desk.
There we go.
I think you answered it. I mean, you hit on a point that I want to go into a little bit more. And that is, I hear that conversation going on in a lot of companies. Do we sort of stay remote after this? And a lot of people are rethinking their sort of footprint, at least their office footprint, in a lot of ways. They're rethinking how they're going to do this now. How do you? I mean, you talked about culture. How do you maintain that culture, and how do you onboard a new person or a new team member, or how do you maintain that culture when you are remote? I mean, if you guys decided to stay remote, how would you do that, you think?
Yeah. And it's a cool constraint to impose, right? Because I don't think that it will be the case that we can't see one another ever in person, but it's definitely diminished. So I was doing some research on this recently, and that feeling as though one is part of a tribe. There's been a lot of that recently. It seems like a lot of it can be recaptured, but you have to be intentional, right? And where it will fall apart, and I suspect this is where it will really fall apart for both less motivated as well as, frankly, less cohesive teams. If everybody gets on a Zoom call at the end of the day, you got a new teammate who's excited to have, hopefully a great job, but like a rewarding job more than just a place of employment. And everybody says, "Oh, hey Jim, how's it going? Nice to meet." Man, that's where it dies. And I think it boils down to, it boils down to leadership, to set the tone, set the example, go the extra mile, to keep everybody going.
Yeah, that's one of the CEOs I talked to said, we may get rid of our big office in Manhattan, but what we may do is downsize to a smaller place with hot desk, and encourage couple days a week or something, people to come in, and so that we can see people and people can get that socialization and that they can see their work colleagues. And so they're rethinking of sort of a hybrid, right? A hybrid of having the big office space versus maybe a smaller downsized place, but still have that capability when needed, or or if somebody really wants to get out of their house, right?
Yeah, absolutely.
Well, this has been great. I mean, this has been fascinating. What are you excited about aside from some of the things you've already talked about? What are you looking forward to in the next year? I mean, we're getting ready to really get into, I think, probably a slowed economy.
Yep.
But you seem very optimistic about that.
Yeah. I still got to keep people healthy, more so now than ever. And that's as much a mission as it is, a business model. Personally, super excited about. I mean, there's been a lot of buzz for a long time about machine learning, or the lethal buzzword AI in healthcare, and I think a lot of it is pure baloney, truly. But there is an opportunity, in the same way that you see now some cars with semi-autonomous driving, right? That can kind of predict that a pedestrian or a bicyclist is going to do something
right.
way better than any driver ever could, right? Certainly than I can.
Yeah.
I think we're going to see some of that come up in healthcare, and I very much intend for CareSignal to be the first and the best with some of that. Here's the example, right? You go to a physician who maybe she's been practicing for 50 years, right? Truly stays up on the journals. This is the person to whom you would go with pretty much any question. That's 50 physician years, right? 50 years of seeing patients. CareSignal now has well over 100,000 patient years of data. We add a new patient day of data every 5 seconds, right?
Wow.
And it's not the data, it's what you do with the data. And what we're doing is predicting engagement. Because come back to that example of that patient, me, I guess, with heart failure, right? Where I receive an intervention to titrate my diuretics, but only when something goes wrong. That only works if I stay engaged in a clinically relevant way for, frankly, a really long time. Doesn't work if I text back or respond via IVR to those questions for a week or two and then stop. So at the same time, there will be barriers, necessary barriers by the FDA and other regulatory groups to make sure that AI doesn't lead healthcare astray. And I think that's why engagement, which is subclinical but so very relevant to outcomes, is such a cool niche. Here's my vision, right? Here's kind of my holy grail. Yeah. I can predict not only which patients are going to disengage or engage less, I can also predict who and how can be engaged most effectively, or rather can receive intervention to stay engaged most effectively for the longest period of time, right? I mean, frankly, the only excuse I think that's reasonable is death for disengagement, and of course, we're trying to prevent that. That's the whole premise.
No point. That's kind of the whole point, right?
That's my vision. I think that would be epic.
That's fascinating. And I mean, when you say this is your sort of where you want to go and where this is going,
yep.
What's the timetable for that to be really sort of the norm, you think?
We're doing it. Where it's already I think even as of the last 2 weeks been rolled out to some of our partners, some of our customers, and their patient populations. Becoming the norm. If this works, it will become the norm without anybody really realizing it, right?
So I would interact with this. I would interact with the system.
Yep.
And ultimately,
yep.
It would prompt my doctor to say, I mean, they could intervene when they know when the systems say, Rhett may not be communicating, but something's going on and we need to intervene.
And we need to intervene, or maybe even one of my teammates, because we have a bunch of patient engagement specialists that we employ, reaches out and says, hey, Rhett, I want to make sure these messages are coming at the right time of day. Or I want to make sure you know that every time you respond, you're helping us take care of you, right? And that might be just enough to close that feedback loop where even if you didn't know you were going to fall off and stop responding next week, we did, or
you knew.
It's kind of the best possible version of Minority Report, if that's a thing, you know?
Yeah, no, I mean, it makes sense, but I mean, we all have, I mean, there's so many people that have, that I can see like my father in this, right? Or 75, getting him to call you back is probably getting to call the doctor in general would be,
that's an uphill battle. Yep.
And he's healthy, but I mean, if something like this can prompt people to do what they need to do for their health, then that makes a lot of sense and can save a lot of lives.
Yep.
Well, this has been fascinating. Hey, Andrew, thanks for the comment, Andrew. Appreciate that. Thanks for tuning in. Anyway, Blake, thank you. This has been interesting.
Oh, it's been a privilege to join.
And thank you for spending some time with us today here on the Power Lunch. Please join us tomorrow. We'll be back with another great show. We've got Aisha Bursall with us tomorrow. And anyway, have a great day. Enjoy your work and enjoy what you do. Hopefully you're doing it with people that you love being around right now, since we're all locked away. Most of us are still sort of staying at home. And anyway, have a great day. We'll see you tomorrow.